Subclavian artery. Subclavian artery has three parts with respect to scalenus anterior muscle. First part, proximal to scalenus anterior muscle. Second part, deep to scalenus anterior muscle. Third part, distal to scalenus anterior muscle. Branches of first part of subclavian artery. Mnemonic VIT, vertebral artery, internal thoracic artery, thyrocervical trunk. Vertebral artery, it goes upwards and supplies the circle of Willis. Internal thoracic artery, it also supplies the mammary gland in thorax called the internal mammary artery. Thyrocervical trunk, it also gives three branches. Branches of thyrocervical trunk. Mnemonic SIT, suprascapular artery, inferior thyroid artery, transverse cervical artery. Suprascapular artery, it is going superior to scapula and participate in scapular anastomosis. It supplies the thyroid gland. Inferior thyroid artery supplies the thyroid gland and cervical part of esophagus. Transverse cervical artery, it runs transversely in the neck region and gives two branches. Transverse cervical artery gives two branches. Superficial branch or superficial cervical artery. Deep branch or dorsal scapular artery. It participates in scapular anastomosis. Usually, dorsal scapular artery is given by third part of subclavian artery. Artery is involved in scapular anastomosis. Suprascapular artery arising from first part of subclavian artery. Dorsal scapular artery usually arising from third part of subclavian artery. After passing the outer border of first rib, the subclavian artery enters the axilla and becomes axillary artery. Carotid triangle and digastric triangle. Digastric triangle. It is bounded by anterior and posterior belly of digastric muscle. The base of triangle is formed by mandible bone. Anterior belly of digastric muscle extends from mandible bone to hyoid bone. Posterior belly of digastric muscle extends from hyoid bone to mastoid bone. Muscles present at floor of digastric triangle. Mylohyoid muscle, depressor of mandible, helps in opening of mouth. Hyoglossus muscle, depressor of tongue. Mylohyoid muscle and anterior belly of digastric muscle develops in first pharyngeal arch and are supplied by mandibular nerve. Hyoglossus muscle is supplied by hypoglossal nerve. Hypoglossal nerve comes from hypoglossal canal into carotid triangle and then enters the digastric triangle to supply the tongue muscles like hyoglossus muscle, carotid triangle, common carotid artery. Inside the carotid sheath bifurcates into internal and external carotid artery. Internal carotid artery remains inside the carotid sheath. External carotid artery comes out of carotid sheath and give 8 branches in the head and neck region. Internal carotid artery is followed by internal jugular vein. Both internal carotid artery and internal jugular vein runs inside the carotid sheath. Carotid sheath. Contents of carotid sheath. Internal carotid artery in the upper part, common carotid artery in the lower part. Internal jugular vein. Vagus nerve in lower part runs in between internal carotid artery and internal jugular vein. In upper part runs behind internal carotid artery and internal jugular vein. Cranial nerve 9, 10, 11 in upper part. Later they come out of sheath and go to their respective places. Anterior to carotid sheath is ans cervicalis. It supplies anterior neck muscles. Behind the carotid sheath is a sympathetic trunk which has a stellate ganglion. Important information. Raynaud's phenomena results in discoloration of peripheral body parts due to ischemia as a consequence of sympathetic vasoconstriction overactivity. Stellate ganglion block can be given for treatment of Raynaud phenomena. Recap. Important information. Phrenic nerve. It is a branch of cervical plexus. Root value is C3, C4, C5. It is identified by the fact that it runs anterior to scalenus anterior muscle in posterior triangle. It should not be blocked in posterior triangle because if it is blocked, it will paralyze the diaphragm.